Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, and thanks for joining me back in the Sunflower House. On today's episode, we're going to talk about migraine headaches, white matter brain changes in women. What are some of the triggers? How do you tell if it's migraine or something else? And what are some of the new treatments? And we have so much information on our speakingofwomenshealth.com website, including treatment guides, health tips, breaking health news. So hopefully you'll bookmark our website and sign up for our free newsletter. Now, I'm going to cover content that I have contributed to speakingofwomenshealth.com, as well as one of our Cleveland Clinic migraine experts, Dr. Marianne Mays. And I'm going to cover some information and columns written by one of our graduated specialized women's health fellows, Dr. Taryn Smith, who is a women's health specialist at Mayo Clinic now in Jacksonville, Florida. She had migraines. I have migraines. Over half the population has migraines. And this is a big problem for women. And in the past, I used to just ignore migraines. I didn't really have very much pain, just couldn't see. The screen would be a little bit, there'd be some blind spots. But now I really pay attention to it because I've seen the white matter changes that can happen in the brain. So why do we get migraines? And who has them? Well, I do, and many of you do too. To the migraineurs, that's the medical term for people who experience migraine headaches, I tell them that you just have a very sensitive and highly developed brain. And so this is part of the reason why a migraineur can experience throbbing headaches with or without a neurologic aura, when there are even just tiny changes in the hormone levels, stress levels, changes in caffeine levels, changes in exposure to certain substances like red wine, MSG, changes in sleep pattern, too much, too little, flickering lights. That's a big trigger for me. I cannot stand strobe lights. Changes in barometric pressure, and certainly weather changes is something that we generally cannot control. When people tell you that they have sinus headaches, 90+% of the time, they're actually migraine headaches. Some people only get migraines on the weekends or while on vacation because that's when they begin to relax and their stress levels drop and their brain sends alarms that something has changed. My husband would get migraine headaches on the weekend. We would spend time driving around in vehicles looking for a home and looking at different homes. Now, a lot of people do that on the screen. Anytime there's a change in what your daily routine is, migraines are very common. It can affect up to 40% or more of United States women. Sometimes it's misdiagnosed as tension headaches or sinus headaches. In fact, 9 out of 10 patients who complain to their doctor about chronic headaches have migraine. Again, those sinus headaches and some tension headaches are actually migraine headaches. So what are the symptoms? Well, they can be throbbing, constant pressure, located on one side or the other, be in the head and the neck. There can be nausea and vomiting, so-called sick headaches. Sensitivity to light or noise during a headache is definitely suggestive of migraine. But these symptoms are not required for the diagnosis to be made. The type of pain can be described as pounding, throbbing, or it can be a dull ache. The pain is usually aggravated by physical activity. Severity, intensity of the pain can be mild, moderate, or severe. But if it's untreated, it usually goes from moderate to severe. The location of pain can shift from one side of the head to the other, or the front of the head, or the entire head. Most migraines last up to 4 hours, but severe ones can go for a week, status migrainosis. The frequency of headaches vary amongst individuals. Some get 2 to 4 headaches per month. Some people may get one every few days, while some people are lucky to only get it once or twice a year. That's me. And I never know when it's going to happen, so I have my migraine nasal spray in like all of my purses and in my car and in my desk because I don't know when it's going to come on, and you want to nip it in the bud when you get it because you want to improve blood to the brain and protect that white matter. So some of the associated symptoms are sensitivity to light, to noise, to odors. There can be abdominal pain. Sometimes unexplained abdominal pain is actually migraine. Usually people lose their appetite. They can have temperature instability. They could be fatigued or dizzy. Sometimes there can be changes in the vision if there's decreased blood flow to the occipital lobe of the brain, which is responsible for your visual perception. Generally speaking, you don't get diarrhea unless the person's really having a lot of pain, and usually there's not fever. So when there's fever and headache or a stiff neck, we worry about meningitis. So some of the warning signs that a migraine may be coming on, it can be classic, so-called migraine with aura, meaning you get some sort of neurologic warning it's coming, or just common migraine, which is migraine without any aura. So the aura is that physiologic warning that a migraine is about to begin, and it's a neurologic warning symptom. And it occurs because parts of your brain aren't getting enough blood flow, and it can be described as scintillating scotomas in the vision, and that's not a new racy outfit. Unfortunately, it's the most common visual aura that precedes a migraine, and I've certainly experienced this. And the first time you experience it can be frightful. It might be like flickering light near the center of your visual field, or shimmering arcs of light, or transient visual impairment and blind spots. And this doesn't have anything to do with your eyeball, but it has everything to do with the decreased blood flow to the occipital cortex of the brain. Up until, a decade or so ago, there wasn't a lot of information known about these white matter lesions. But these cerebral abnormalities and migraines, an epidemiologic risk analysis followed both men and women with migraines for almost a decade, and there was progression of these white matter lesions, but only interestingly in women. These white matter changes don't appear to increase migraine frequency or accelerate cognitive decline, so that part is good news. But anything that's going to affect your brain, since we all need our brain to have our wits about us, certainly should get your attention. And I tell women it's not good to have migraines, even if it doesn't cause you pain. Like, I really don't have pain. I just have the neurologic visual symptoms. And it's not good because there is less blood flow to an important organ, your brain. So about 15 to 20% of migraineurs do get the aura. It can occur before, during, or after pain. It can last from 15 to up to 60 minutes. Like bright flashing dots or lights, those blind spots, distorted vision, even temporary vision loss or very wavy and jagged lines. Some people just describe it as a funny feeling and they can't really describe it. Other people can hear ringing in the ears, tinnitus, or have really changes in the smell like strange odors or different taste or touch. Rare migraine conditions can include neurologic syndromes like hemiplegic migraine, where there's temporary paralysis on one side of the body. Retinal migraine can be temporary or partial complete loss of vision in an eye along with a dull ache behind the eye. Basilar artery migraine, which can present with dizziness and confusion and loss of balance. The headache pain may affect the back of the head. These symptoms can occur suddenly and be associated with the inability to speak properly, with ringing in the ears, maybe vomiting. This basilar type of migraine is strongly related to hormonal changes and primarily affects young women. And I've seen a couple of dramatic cases. Now, status migrainosus is a severe and rare type of migraine that can last for 3 or more days. Pain and nausea are so intense, people usually need to be hospitalized to get IV fluids. Certain medicines or medication withdrawals can cause this type of migraine. Now, ophthalmoplegic migraine is pain around the eyes, and it might even include paralysis of the eye muscles. This is an emergency condition. because it can also be caused by pressure on the nerves behind the eye or an arterial aneurysm. There can be droopy eyelid, double vision, or other vision changes. And a lot of these symptoms can be also symptoms of stroke, which is a brain attack, which needs immediate medical attention. So if you have new or acute symptoms, or one of your loved ones or friends or coworkers do, even if they've had migraine, you can't assume that that's what it is, and they do need to be evaluated emergently. So what are the types of symptoms of migraines without aura? Well, 80 to 85% of migraine sufferers just have the regular migraine. Beforehand, some people get more anxiety or depression or notice a little more fatigue. For some of us, migraine is just a minor nuisance. For others, it can wreak havoc on vacations, take a toll on one's well-being, work productivity, both at home and work. For years, we've known that migraineurs can have changes in the white matter substance of the brain that looks like mini strokes on a CAT scan or an MRI of the brain. What are the exact causes of migraine? Well, we're not exactly sure, but we know it relates to changes in the brain as well as genetic causes. Certainly, people with migraines may inherit the tendency to be affected by certain triggers, such as fatigue, bright light, weather changes. For many years, scientists believed that migraines were linked to the expanding dilation and constriction, narrowing of blood vessels on the brain's surface. But now we believe that migraine is inherited by abnormalities in certain areas of the brain. There's a migraine pain center or a generator in the midbrain level. A migraine begins when hyperactive nerve cells send out impulses to the blood vessels that can lead to dilation of these blood vessels and the release of prostaglandins, serotonin, and other inflammatory substances that can cause the pulsations to be painful. Certain brain cells use serotonin as a messenger and are involved in controlling mood, attention, sleep, and pain. Therefore, chronic changes to serotonin can lead to anxiety, panic disorder, and depression. And many people that have serotonin problems are more likely to have migraines. For a discussion on neurotransmitters, and why women like chocolate, and things that affect your neurotransmitters, make sure you catch my podcast on why women like chocolate. So what triggers a migraine? Well, external factors can, including emotional stress, and many migraine sufferers are just more sensitive. And during stressful events, certain chemicals in the brain are released to combat the situation. It's kind of known as the fight or flight response. Sometimes release of these chemicals can provoke migraine. Anxiety, stress, worry, excitement, fatigue, change in schedule can increase muscle tension, and this can trigger more migraines. Certainly, sensitivity to specific chemicals and preservatives in food are triggers for many people. Certain foods and beverages like aged cheese, alcoholic beverages like red wine, food additives such as nitrates in pepperoni and hot dogs and luncheon meats, and monosodium glutamate, MSG, which is commonly found in some Chinese and ethnic food, may be responsible for triggering up to 30% of migraines. Caffeine, excessive caffeine consumption, or withdrawal off of caffeine can cause headaches when the caffeine level abruptly drops. Sometimes caffeine is helpful in treating acute migraine attacks. Changing weather conditions such as storm fronts, barometric pressure changes, strong winds, or changes in altitude. Menstrual periods. The drop in estrogen before the period is a common trigger for menstrual migraines. Missing meals. Some people are very sensitive, and that can trigger a migraine. Changes in sleep pattern. So you might ask, are migraines hereditary? Well, they do have a tendency to run in families. 4 out of 5 migraine sufferers do have a family history. If one parent has a history of migraines, the child has a 50% chance of developing migraines. But if both parents have a history of migraine, the risk jumps to 75%. Both my husband and I have migraines, but really our three sons don't. Maybe one has had a couple migraines, but luckily they don't seem to have migraines. There's many medicines available to treat migraines. Symptomatic relief can be used, especially when there's pain or nausea or vomiting. There are over-the-counter medicines that can be used, like aspirin, ibuprofen, naproxen, with or without caffeine. But you must be cautious when taking over-the-counter pain-relieving medicines because sometimes they can contribute to a headache. And regular use can lead to analgesic rebound headaches or an actual dependency problem. So if you're taking any over-the-counter pain medicines more than 3 times a week, certainly if you're doing it daily, it's really time to see your healthcare clinician who can suggest prescription medications that may be more effective. Some people need anti-nausea therapy, and this can be done orally or rectally if there's too much nausea and vomiting. Now, abortive medicines are most effective when used at the first sign of migraine to stop the process that causes this whole cascade. And abortive therapy might prevent the symptoms, including pain and nausea and light sensitivity. And abortive medications may work by affecting the blood vessels and help relieve the throbbing pain. Now, there's another class of medicines, preventive or prophylactic, that might be prescribed when the headaches are severe and occur more than 2 or 3 times a month and interfere with normal activities. Preventive medications reduce frequency and severity and generally are taken on a daily basis. All of these treatments should be used only under the direction of your physician or a headache specialist familiar with migraine therapy. And you must, of course, follow the instructions. Now, biofeedback training can help. People can learn to recognize stressful situations that trigger migraine. If the migraine begins slowly, many people can use biofeedback to stop the attack before it becomes full-blown. Identifying and avoiding migraine triggers should also help. Keeping a journal can be helpful. Recalling what you ate prior to an attack. Women who get migraines during their menstrual periods many times find relief during pregnancy and after menopause. Hormonal treatment of migraines generally is not always satisfactory, but sometimes can be effective, particularly if there's very clear menstrual cycle patterns. And one can take prevention to prevent that drop in estrogen, which triggers headaches in many women. Stress management and coping techniques, along with relaxation, can help prevent or reduce the severity of a migraine attack. Migraine sufferers also seem to have fewer attacks when they eat regularly and get adequate rest. And it's very important to keep your sleep cycle the same, regardless whether it's a holiday or weekend or vacation. And exercise in moderation, preventing dehydration, also can help prevent migraines. So what's the risk of stroke in people who get migraines? There still remains concern that some migraineurs may have a higher risk of stroke. Therefore, everyone, especially female migraineurs, should try to work to reduce your risk of stroke. That will definitely damage the brain. Estrogen has effects on neural tissue, and this may be part of the reason we see sex-related differences in migraine and other neurologic conditions, like multiple sclerosis, which is much more common in women than men. So what are some of the risk factors for strokes that are treatable and modifiable? Avoid weight gain. Don't smoke. Treat uncontrolled hypertension. Anybody over the age of 50 should have a home blood pressure cuff, or anyone who's had elevated blood pressure. Physical inactivity. Elevated cholesterol levels with bad ratios and inflammation. And atrial fibrillation, which is more common in women than men. And we have a free atrial fibrillation treatment guidebook on speakingofwomenshealth.com. Women who have complicated migraines with aura should try to avoid fluctuating hormone levels and should avoid cycled high doses of estrogen-containing hormonal contraceptives. Keeping a lower level and a constant level is much better. Knowing how to prevent and treat migraines remain very important. And like I said, some migraineurs definitely need to be on preventive treatments. Some only need intermittent treatments with a triptan medicine. For some, it just may mean simply avoiding strobe lights and a bad 1970s disco scene. That seems to work for me most of the time. For others, it means really keeping diet, exercise, stress, caffeine, sleep on a very constant and stable regimen, all of which have their own health benefits. Menstrual migraine. If you're dealing with a monthly menstrual cycle, if that's not enough of a hassle, menstrual migraine associated with it can be very difficult and hard to control. So typically these headaches are triggered when the estrogen levels drop right before menses, or when there's hormone level fluctuations with ovulation. That was the first migraine headache I had. It was several months after I had my first son. When I resumed my ovulation after not ovulating for quite a long time, that was my first trigger. Some women can have migraines after delivery because there's a marked loss in estrogen, but usually migraines get better during pregnancy. Hormones and headaches. In the past, headache specialists were nervous about the type of any hormones in their patients with migraine for fear of stroke. But the right type of hormonal contraceptive agent may eliminate headaches by stopping hormonal fluctuations. We have pills and patches, vaginal rings, and luckily the updated guidelines from the American Headache Society and other groups emphasize a tailored approach to the management of headaches in each woman, as opposed to just doing blanket discouragement of an option for everyone. But if you're going to use hormonal contraception, generally we use it without the placebo break. We don't need to have artificial up and down of hormone levels. And we generally don't want to pick hormones that have fluctuating levels. And if you don't have an aura and you don't have other risk factors, usually you can still use hormonal contraceptives. Now, what about headache and pregnancy? More than half of women with migraine report improvement with pregnancy. What about the other half? Well, most headaches that occur during pregnancy are, in fact, migraine, but you still need to see your doctor to check for secondary causes. The hypercoagulable state of pregnancy can certainly increase the risk of secondary headache disorders, and this risk remains for about 6 weeks postpartum because the body's undergoing rapid hormonal changes as it returns to its non-pregnant state. So treatment for migraines during pregnancy, there's many available treatments, pharmacologic, non-pharmacologic. It is important to note that chronic pain can lead to depression and anxiety and insomnia. And all of these things seem to be...
We'll be back after a quick break.
Hey, quick question for you. Are you someone who wants to be fit, healthy, and happy? And what if I told you you could get your dream body by simply just listening to a podcast? I'm Josh.
And I'm KG, and we're the hosts of the Fit, Healthy, and Happy podcast.
Listen, we get it. Fitness isn't easy. Carbs, no carbs.
Just stop, okay? It doesn't have to be that complicated. And that's why we made this podcast. We get straight to the facts so you can become your best you.
So the way to check us out is click the link in the show notes or search Fit, Healthy, and Happy podcast on any of the major podcast platforms. We'll see you soon.
Worse than using medications. Ultimately, medication risks are the highest in the first trimester, so we generally like to try to delay pharmacologic treatments until the second trimester. But before taking any medicine when pregnant, prescription or over the counter, you must check with your physician or your midwife first. So Dr. Mary Ann Mays, who is a neurologist at the clinic, contributed an excellent column on headache, go away, come again some other day. And this was posted over a decade ago and recently updated. And she says that on rainy season, she gets many calls from patients having difficulty controlling headaches. And it would remind her of the time that she was a child and would sing, "Rain, rain, go away, come again some other day," in order to get outside and play again. For migraine sufferers, the pain experience can cause disability and limit their activities. And for some people, this is actually when the rain does go away. So 3 out of 4 migraine sufferers notice that weather triggers them. It's possibly an overestimation. Maybe it's more like 50%. But temperature, humidity, dry conditions, windy weather, or super bright sunny days. I remember telling my family I feel like I'm a what's the animal that, or the werewolf that you can't see the sun, because in Northeast Ohio we have very cloudy, overcast days, and you can go a month or more without seeing the sun. And sometimes after going weeks and weeks on end with no sun, and then that first bright sunny day, ooh, that triggers me. Barometric pressure changes as well. And obviously, many people live in climates where there's 4 seasons, and changes in the spring and fall can really be particularly bothersome for some. And a lot of migraine sufferers that have seasonal changes, they inappropriately attribute them to allergies when it actually can be just the changing weather. And studies have shown headache patients are a lot more likely to visit urgent care or emergency room during warmer weather when there's a drop in the barometric pressure. Well, if you don't like the weather, wait till it changes. Dr. Mays says that when she lived in Milwaukee, the meteorologist slogan would remind people that you can't predict the weather. And so for those migraine sufferers vulnerable to weather changes, it makes it difficult to plan activities, sometimes for fear of developing a headache. And her patients had pointed out to her that AccuWeather and Weather.com have forecast for your headache based on current weather conditions for the city. And she can't vouch for the accuracy of these tools, but found them interesting. And AccuWeather's headache forecasters apparently utilize current weather conditions with how the weather's changing to predict the probability of experiencing a migraine headache, as well as how intense it may be. And certainly there's smartphone apps that can be downloaded for tracking of headaches, and they can be useful tools for headache sufferers to track the headaches and plan activities. That is, if the meteorologist is right. So don't call the moving truck just yet, because unless weather changes are your only migraine trigger, it's unlikely that moving to a different area that has a pleasant uniform weather all year long will likely be a cure for your migraines. The fact of the matter is that all cities and rural locations experience weather changes that may precipitate headaches. So a better solution is to talk to your physician about using a daily preventive medicine if needed to prevent or decrease the frequency, and have a plan of attack to treat the migraine at the first sign of it. So Dr. Mays, who's the director of our neurology residency program, is a staff physician at the Headache and Facial Pain Clinic within the Neurologic Institute at the Cleveland Clinic. So, if you have migraines and want to know what some of the treatments are, we are going to go over that information. And some of this has been presented in column form by Dr. Taryn Smith, who's one of our exceptional graduates. And I remember one of the first times I saw her having a migraine headache, you could just feel how intense that it was. And that's when I suggested, well, I think you need to do a little research on this. And after you get your migraines in better check, it'd be great to provide some content on our speakingonwomenshealth.com website. So there's a lot of different categories of therapy. Abortive therapy is for when you're treating the acute condition, which can include pain medications, prescription medicines like dihydroergotamine, and then the various triptans. The first one was Imitrex, generic name sumatriptan, and we have several: Zomig, Maxalt, Relpax, Frova. Some are used for menstrual migraine. I personally have used the Zomig nasal spray because you just squirt it up. I do the right nare if it's on the right side, or the left one if it's on the left side, and it works like a charm. Some people need prophylactic treatment though, And there's oral medicines like topiramate, Topamax, but that can have certainly significant side effects, some brain fog, kidney stones, even rarely Stevens-Johnson syndrome. It does suppress appetite and it does reduce migraines. It's in the anticonvulsant class of medicines, so there's a role for it, but you do have to be monitored. Botox injections aren't just for muscle spasm or cosmesis. In fact, it appears that the onabotulinum toxin A is taken up and actually affects the neuronal cells. Now, we've used blood pressure class of medications for a long time, like beta blockers, propranolol, Inderal, calcium channel blockers as well for prophylactic therapy. And if you've got migraines and hypertension, sometimes it's helpful to be able to pick an agent that might treat 2 or 3 of your medical problems. Certain anticonvulsants, which are also mood stabilizers, like divalproex sodium, known as Depakote, is another option. Certain antidepressants, anti-anxiety agents like venlafaxine, Effexor. Also, Cymbalta is another one that can be very good at reducing headaches. Most of the time, taking some B-complex vitamins, including riboflavin B2, in doses of 100 to 400 milligrams, much higher than the recommended daily allowance, along with magnesium, which boosts dopamine, many times can help reduce migraines. But it's exciting that in the last several years, we've seen multiple new therapies for the treatment of migraine, and they certainly can be life-changing. We did mention Botox injections, and it works by blocking neurotransmitters that actually transmit the pain signals to the brain. And each session consists of a series of 31 injections all around the head and neck. And these sessions are spaced out about every 3 months and take at least 15 minutes to complete. You can have neck pain, headache, eyelid drooping, muscle weakness, pain or spasm, or pain at the site of the injection. And certainly if you get too much Botox, you can have weakness of muscles leading to difficulty swallowing, breathing, blurred vision, loss of voice, loss of bladder control. So this has to be done by a healthcare clinician that is trained in this. There could rarely be infection at the injection site, and some people are allergic to the botulinum toxin. Now, a whole new class of medicines called neurotransmitter calcitonin gene-related peptides, CGRPs. Aimovig was the first medicine in its class to be approved by the FDA to both prevent both chronic as well as episodic migraine. And it's a once-a-month injection that blocks this neurotransmitter calcitonin gene-related peptide. Now, side effects of Aimovig can include pain at the site of the injection and constipation. But if you're a migrainer, generally speaking, without renal insufficiency, you probably should be on magnesium, which helps reduce constipation. And if you're allergic to Aimovig, which the generic name is Aranumab, then you should obviously not take it. Another one in this class of medicine is Anjovi, Fromazumab. And Anjovi, like Aimovig, is that CGRP agonist, and it's for the prevention of migraine headache. And it's available in 2 doses, so you can either get a monthly or a quarterly injection. Side effects can include pain at the site of the injection, and again, it should be avoided in people who are allergic to fromazumab. Emgality, also generically known as galcanezumab, is another monthly injectable CGRP antagonist. But unlike Aimovig and Anjovi, Emgality can be used for prevention of migraine headache as well as the treatment of cluster headache, which is a very painful, difficult headache syndrome. Again, there can be pain at the injection site, and it should, of course, be avoided in anyone who's allergic to the generic galcanezumab. Now, there are non-medication new treatments for migraine. Nerivio Migraine is a wearable electronic device used for the treatment of acute migraine. It's worn on the upper arm during an acute migraine attack, and you use your smartphone to enable the technology, and the device relieves migraine through electronic pulses that block pain. And so for people that are chronic migraine sufferers, also people with episodic migraine who don't tolerate side effects or don't want to take a preventive medication or an abortive medication, there can be a sensation of warmth, arm pain, or redness, or numbness. So these are just some of the options that are available for you if you're one of the 40 or 50% of people that have suffered with migraine. So thank you so much for listening to us and joining me in the Sunflower House. I'm your host, Dr. Holly Thacker. And if you want to help support the podcast, share it with others or donate to our nonprofit. Or you can leave a 5-star rating and review. To catch all the latest from me, you can subscribe on Apple Podcasts, Google Podcasts, Spotify, TuneIn, wherever you listen to podcasts. And thanks again, and I'll see you next time in the Sunflower House.